Imagine waking up every single morning feeling like your bladder is on fire. You're rushing to the bathroom again, you just went 30 minutes ago, and the relief lasts about 10 seconds before the pressure and the burning is back. Your doctor run test, urine comes back normal, there's no UTI, you're told everything looks fine, but nothing feels fine. If this sounds familiar to you, you are not alone. What you may be dealing with is a condition called interstitial cystitis, one of the most underdiagnosed and misunderstood, and also undertreated bladder conditions in patients today. Hi everyone, I'm Dr. Peter Aziz, your gynecologist and pelvic surgeon. In the next 10 minutes, I'm going to give you real answers about what IC or interstitial cystitis is, why it happens, how it's diagnosed, and most importantly, what you can actually do about it. Before we go any further, if you are new here, welcome to my channel. This channel is dedicated to pelvic health, urology, sexual health, and overall wellness, all explained clearly and backed by evidence-based medicine. I also offer health coaching and Q&A sessions for people who want personalized guidance for things they've been struggling with. The link to book is in the description below. Now let's start talking about interstitial cystitis. So IC is a chronic condition that causes bladder pain, pressure, urgency, and frequency of urination without an infection being present. Some doctors can call it painful bladder syndrome. Here's what is happening in the bladder. So normally the inner lining of the bladder, it's called the urothelium, it acts as a protective layer or a barrier. It keeps the concentrated substances in the urine from irritating the bladder wall underneath it. So in patients with IC, that protective lining is damaged or it's defective. So what does that mean? It means that the urine is going to start leaking and is going to start irritating the bladder, causes chronic inflammation and pain, and those relentless trips to the bathroom. What is unfortunate and challenging about IC is that the average patient can wait anywhere from 4 to 7 years before receiving a correct diagnosis, which is completely unacceptable. This is exactly why we need to talk about this in details. So I get asked, hey doc, what can cause IC? Honestly, we still don't know exactly. There's not one single cause that have been identified that tell us why IC is happening. There is a lot of multiple overlapping factors. However, here is what the research is pointing to. So possible contributing factors: a defect in the bladder protective lining. It's allowing the urine to irritate the nerves and the tissue. It can be an autoimmune activity. That means that the body is attacking itself. It can be an overactive or hypersensitive nervous system that amplifies pain and amplifies the pain signals going to the brain. It can be pelvic floor muscle dysfunction, which can also coexist with IC and can worsen the symptoms. I've also seen a history of recurrent urinary tract infections that have altered bladders over time. One thing I've also noticed that there's certain genetic predisposition. IC does appear to run in certain families. We see it more commonly in women than men, and it most often affects women between the ages of 30 and 50. Sometimes if you have pelvic pain, fibromyalgia, IBS, or other pain conditions can make it worse. So what does IC feel like? What are the symptoms? This is where I want you to really pay attention, because IC symptoms can mimic a lot of other problems, and they can vary significantly from one person to the other, and can also vary on a day-to-day basis. However, the core symptoms of interstitial cystitis can be that constant chronic pelvic pain or pressure that is often in the lower abdomen or between the legs. A lot of times we see urgency of urination. What does that mean? It means that you suddenly really have to urinate, and it's hard to control. It's not that, oh, I can hold it for a little bit. Urgency is you're going from 0 to 100 pretty fast. You also go to the bathroom more frequently, sometimes even in the middle of the night, that it will wake you up. The pain is usually worse as the bladder is filling. Why? Because the urine is an irritant, and as the bladder is filling, the lining of the bladder is defective, so the urine is irritating the nerves in the bladder. And a lot of times the pain actually gets better after you urinate because the bladder is empty. The burning or discomfort can be in the urethra. It can also be during or after intercourse. One of the most important patterns to recognize is this. It's unlike a urinary tract infection, the symptoms of IC are persistent. They are not tied to a single episode of infection. Because with IC, you can get a urine culture, and guess what? It's gonna come back negative. You can take antibiotics, your symptoms will still be there. The antibiotics will not help your symptoms. They will keep coming back, and you'll be like, well, what is going on? There tend to be some flare-ups with triggers. Triggers that can irritate the bladder, like coffee, alcohol, spicy food, citrus, hormonal changes, or even stress. All of these things can make your pain worse. All right, so how is IC diagnosed? There is no single definitive test for interstitial cystitis because the diagnosis is largely clinical, meaning it is based on your symptoms, on your history, and pretty much ruling out any other conditions like stones or UTIs or cancer, or anything that can cause similar problems. So the diagnostic process typically includes pretty much history. How long have you had the problem for? Frequency, location, what makes it better, what makes it worse. Of course, you'll have a urine analysis and culture to rule out infection in the bladder or blood in the urine. We generally do something called a bladder diary. What does that mean? A bladder diary is basically tracking how often you urinate, how much, your pain levels when the bladder is full and when it's empty. Your doctor will generally do an examination to assess the bladder, the urethra, the pelvic floor, the rectum, surrounding structures. If everything looks normal, sometimes we would do something called a cystoscopy. The cystoscopy is simply inserting a tiny camera inside of the bladder to look on the inside to see if there is any changes on the inside, if there are any foreign bodies, tumors, stones, anything that can give you the same symptoms like IC. Sometimes we see certain characteristic changes that are specific to IC. However, it's not very common. Only 20% of patients with IC, we will see something positive when we look inside of their bladders. So based on the guidelines that we have, the diagnosis of IC should be considered in any patient who have painful bladder or chronic bladder pain, along with some urinary symptoms, once infection and other causes have been excluded. So this is the major reason why the diagnosis of IC is generally delayed, because IC shares symptoms with a long list of other conditions and are often treated for one of these instead of being treated for IC. So what are the things that can often get confused with IC? So recurrent UTIs, that's the most common misdiagnosis. Oh, I'm having pain when I urinate. You have an infection, here you go, you take antibiotics. Hey doc, I didn't get better. Really, let's give you a different antibiotic. Hey doc, I still didn't get better. Urine culture comes back negative. That's most likely IC. Overactive bladder can also give the same symptoms like IC. So what is overactive bladder? It's generally urgency of urination, frequency, sometimes leakage of urine before you get to the bathroom, but that's because of a different problem. That's because the muscle of the bladder is working a little bit too much that is making you to go to the bathroom more. It is not a painful response. Endometriosis, pelvic floor dysfunction, vaginal pain can also have the same symptoms. Really the big one is bladder cancer, which must be ruled out first before we make the diagnosis of IC. I've seen sometimes patients who have sexually transmitted infections that can have the same symptoms as IC, especially if they kept getting reinfected with the same organism. It is very important to know, do not just keep taking antibiotics for something that is not an infection, especially a bacterial infection. There has to be a positive culture, whether that's a urine culture or a genital culture for an STI. So the biggest question, what is the treatment, doc? Unfortunately, there is no cure for IC. I have to be very honest and direct about that. However, there are some effective treatments that can reduce your symptoms and also restore your quality of life. Think about IC like high blood pressure or diabetes, for example. It's not something that, hey, take this medicine and you're going to be cured. It's something that lives with you, and we just have to learn to find ways to cope with it and get it under control. Treatment is stepwise, it's personalized, because what works for you might not work for someone else. And it's going to take a little bit of trial and error. The first thing that I usually tell my patients is dietary modifications or behavioral changes, because we have to identify the things that can irritate the bladder and eliminate them. Like we discussed, caffeine, alcohol, citrus, spicy food. All of these things can irritate the bladder a lot. Might not all of them. So maybe you choose one of them, let's say caffeine. So start cutting back on caffeine for a couple of weeks and see if that makes you feel better. If not, then maybe caffeine is not the problem. Maybe it's soda, maybe it's spicy food. And do that gradually until you find something that makes you feel better once you stop it. There are some oral medications that can help. So when you talk to your doctor, they might offer you some pills, something like Elmaron, something like amitriptyline, like hydroxyzine, certain nerve pain medications like gabapentin and Lyrica. They can also help get the pain under control. However, narcotics are generally not recommended for bladder pain, and it can help a little bit if you have a flare-up. However, they're not meant for chronic use. If oral medications did not work, there is an option where your doctor can push some medicine inside of your bladder through a catheter. It's a cocktail of medications that include lidocaine, which is a numbing medicine, some steroids, some anti-inflammatory drugs. They're mixed into like a liquid cocktail. Your provider will put a catheter inside of the bladder, drain the urine, and then push the cocktail medicine in. And that usually works really fast. Patients generally get repeat treatments every couple of weeks for a few weeks, and that can decrease the pain and decrease the flare-ups. Another option is something called cystoscopy with hydrodistension, meaning that it's pretty much stretching the bladder. It is done in the operating room while you're asleep, because that procedure can be uncomfortable. Your doctor will place a camera inside of the bladder and keep stretching the bladder until it cannot be stretched anymore. And then basically hold it for a few minutes, and that stretching can actually confirm the diagnosis and provide some temporary symptom relief. If your doctor finds any ulcers or lesions, things that are bleeding, the doctor can actually cauterize or laser those lesions, often with excellent results. Just keep in mind, managing IC, it's not just about medications. Your daily habits matter enormously. So keep in mind that what you do on a daily basis will make a big difference. So eliminate your irritants, stay hydrated, reducing stress. Sometimes even working with a pelvic floor physical therapist can help a lot with your pain, because it can treat pelvic floor dysfunction, which can worsen IC pain. So when you take care of one problem, the second one gets better. Staying hydrated is very important because concentrated urine is more irritant to the bladder. So avoid becoming dehydrated. So drink enough fluids, because when the urine is diluted, it doesn't hurt as much. So if you're having that persistent bladder pain, urgency, frequency for more than 6 weeks and you don't have an infection, it's time to see a specialist. Not just a general practitioner, but you need to see either a urologist or a urogynecologist with experience in bladder pain conditions, because you have to get a real evaluation, a real diagnosis, and they will offer you the treatment plans that work for you. If you found this video helpful, please subscribe to my channel, like this video, and share it with someone who might benefit from it. Leave questions in the comments below. I'll do my best to address them. Thank you very much for watching. I'm Dr. Peter Aziz.